Namaste, welcome to the second episode of Clinical Ayurved by Dr. Mayuresh Agte. We were discussing Rasayan Chikitsa and we have seen the factors which should be required in the body to perform the Rasayan Karma. First, it was Dhatu Poshak Ahar, then it was Prakuja Atrani, then it was Vata Anuloman or absence of Sotorog, then Prakut Dhattvagni. When all these factors are present, our Rasayan Karma is achieved. And I have asked you which is that factor, one more factor, which should be present in the body to sustain this Rasayan Karma for longer time. If that condition is not present in the body, your Rasayan Karma will get hampered. And which is that? Let us see. See what happens at Jatrani level and Dhatani level. Whenever there is function of Agni, there is going to be digestion or pachan, and there are always two byproducts of every digestion. One is Sarava and Kittava. Now in our case, Aharas is formed and then Aharas is transported to Dhatus. Dhatus get activated and Dhatus get activated. They create action on the Aharas which has reached to their srotas and they produce dhatu. So all these functions, if this functions well, the dhatu is formed. But at the level of Jatrani as well as at the level of Dhattvagni, whenever there is pachan, the second product is always formed, which is called as Kittavag or Malabhag. If this Malabhag or Kittavag gets accumulated in the body and doesn't get exceeded within time, then this accumulation of mala will create diseases and it will hamper your aim of Rasayan Karma. So next condition which is required in the body to sustain this Rasayan Karma is mala pachan or mala utsarjan. Now we will come to these points in more clinical way. It is rarely happens that patient comes to you, he is healthy and asks you to give me Rasayan treatment to live longer. It rarely happens. Most of the time, patient gets some disease, he comes to you for the medicine, you give the medicines, he gets cured, and then he asks, now give me some medicine which will keep my health at optimum level. In this condition, you have to think all these points, no doubt about it. But specifically, you have to think of the samprapti of the disease which was present in the body when he was abnormal. Now, we will relate these points with the various diseases. First, Dhatu Poshak Ahar is common to all because without good proper nutrition, no Dhatu will be formed. So it is common to all of them. Now, Prakrut Dhatu in Dhatu Chikitsa, so Dhatu Poshak Ahar, always remember Ahar Dravya which can work as a Rasayan are important. For example, Dugdha, Ghruta, as well as the Aushadhi Dravya which have got Madhur Shit, Rasaya Vipak are important because they are going to build up Dhatus. Second part is Prakuja Atrani. When a patient has suffered from Jvara or Agnimandya, which are Agnimandya Pradhan diseases, in that case, when you are going for Rasayan Chikitsa, you have to think of this Prakrut Jatragni factor more importantly, more priorly. So, choosing Rasayan Dravya in such patients which have got Agnimandya as a main factor as a disease in the Samprapti, you can use Dravyas with Ushna Krishna Ruksha property and having Rasayan Karma like people. Third category, if patient is suffering from Udara, it has been cured by you. Now, Udara is Agnimandya Janit, Amajanit as well as Srotorodha Pradhan disease. So, after curing Udara, you should think of the Rasayan Dravya which will have Dipan, Agni Dipan as well as Ampachan and Srotorodnashan as a function. So in that case, you can use Bhallatak, Chitrak or drugs like Kumarin, Katuka. When there is a Dhatpagni Mandya Janit Azar, like say Rakta Kshinata or Pandu as we discussed in the last episode, or there is loss of weight, Karsha is there, Mausaksha is there, then you should choose the drugs, Rasayan Dravya, which will act on Dhatpagni. For example, Guruchi will act on the Dhatpagni, Vasantakalpa will act on the Mansa Dhatpagni. So according to the need of the Dhatu, you should choose the drug which will have Rasayan Dravya as a karma as well as Dhatpagni action. The diseases like Shotha, which are Kleda Pradhan, the Sachiti of Drava, in that case, you should use after curing Shotha to prevent the reoccurrence, Rasayan Dravya like Pundanava, Gokshur are important because they are going to remove this Kleda from the body and the Samprati which was happened previously will not reoccur. In case of Malabhat, you can use Malapachan Dravyas like Haritaki, which is also Rasayan Dravya. So, in practice, patient comes to us mainly after the curing of the disease and he is expecting us to give some medication so he will not have any recurrence of that same disease. So, in that case, along with these common 6 factors, you have to think of the specific samprati happened in the patient's body and you have to choose that Rasayan Dravya which will be helpful to prevent that samprapti again. I am specifically given only 1 and 2 examples of all these points. Why? Because I am expecting you to go to the text and add your own list according to these points, samprapti of the diseases and useful Rasayan Dravyas in that diseases. When you will go on your own, then you will recall them in practice. Spoon feeding will not be helpful at all. So, homework for you is just take these points together, add your dravyas, go to the text, see Rasayan Dravyas, their Rasayupat, and in which of these points they get fit to produce action or to use the patient. Or similarly, the disease wise, you can choose the Rasayan Dravyas to prevent its reoccurrence. I hope you have understand these points and their clinical application. Now, in how much way you can use it, it depends on you. For example, when there is Jathani problem or Dhatani problem, you can use Ghuta Kalpana because Ghuta itself is a Dipan Agnivardhan by Prabhav. When there is Srotorut Pradhan Samprapti, you can use Asavarishta Kalpana, for example, Chitraka Asav, Ballataka Asav, Pippalya Asav, because they will add to the Bhedan Karma or Sotorod Nashan Karma because of Vyavai Vikasi Guna. In case of Kleda Nashana, you can use Punarnava Sav, Gokshadik Vad, again Asavarishta Kalpana, which will increase their potency. So, after choosing Rasayan Dravya, you can again go to the next step by choosing the proper Kalpana of that Dravya which will act very fast. Now, again, a homework for the next week. Rasayan Chikitsa we have discussed in clinically. Rasayan Adhyay has been mentioned by Charak or all other texts. At the same time, we come across the words or terminology Jivaniya, Balya, Bruhaniya and Vayasthapan. They have described Rasayan Chikitsa as a separate entity as well as they have described these words, their Gana, as a separate entity. Then what is the difference between Rasayan Chikitsa and these Jivaniya, Balya, Bruhaniya, Vayasthapan terms and their clinical application? Homework for you. We'll meet you next week on Friday. Thank you very much. Please give your suggestions, honest suggestions and comments in the comments box. Thank you very much.